Urologic Health with Dr. Ricardo Gonzalez, urologist and FPMRS specialist.
So why would a man consider a treatment option for their prostate other than a TURP, or transurethral resection? Well, perhaps someone recommended a TURP to you or to a family member, but you've heard of alternatives, lasers, these needle ablations like Rezum, Urolift. Why would you consider that instead of the traditional operation? Because the prostate has a rich blood supply, prostate surgery has traditionally been considered a bloody endeavor. And so any sort of operation on the prostate can cause it to bleed, requiring us to burn or fulgurate bleeders or use a catheter to help stop the bleeding. But the newer techniques either avoid the bleeding altogether, do a better job at stopping that bleeding than the traditional operations done on the prostate. And also, because the prostate's an ejaculatory gland, anything that we do to the prostate with surgery or with medications may affect its function, which means the medications may affect ejaculation, or the procedures may affect our ability to ejaculate. And so over 80% of men who have traditional prostate surgeries will lose the ability to ejaculate, causing what can be referred to as a dry orgasm or retrograde ejaculation. The newer therapies have advantages on both fronts. Newer procedures are less likely to cause bleeding, which gives us advantages to have less time with a catheter. And also they're less likely to affect ejaculation, making them attractive options for men who are interested in bleeding less and having less ejaculatory problems. Let's talk about 3 of the newer options. First, we'll talk about PVP, which is photoselective vaporization of the prostate, or green light surgery. When that was compared in its newest version of 180 watt laser to transurethral resection, or TURP, it was found to have the same benefit in terms of alleviating urinary symptoms, but it has 5 times less bleeding complications, allowing patients to spend less time in the hospital or the treatment facility, less time with a catheter, and a faster recovery because of those. The men in that study were also less likely to need a re-intervention, so they were less likely to need a catheter replaced or less likely to need another procedure to stop bleeding after that surgery. So what that has achieved with green light, it allows us as urologists to treat the prostate in a safer way, and for the men who are treated with green light to return to their normal activity sooner and with less risk. MIST procedures are minimally invasive surgical therapies. These MIST procedures are probably not as strong of an intervention as traditional surgeries like TURP or like green light, in the sense that they don't remove all of the obstructing tissue and definitely don't do it right away, but they can alleviate the symptoms in a way that allow men to improve their quality of life and not need to take medications anymore. So they do help, probably not to the same degree as the surgeries I was just talking about a second ago, but can help improve symptoms dramatically in many men. And there are particular benefits to men who want to preserve ejaculation, because MIST therapies like Rezum, which is a steam-based treatment, or Urolift, which is how we do the prostatic urethral lift procedure, those allow men to have normal sexual function with normal ejaculation and don't typically affect ejaculatory function in men. So it's a good way to treat symptoms and not affect ejaculation. So what are the downsides to considering a less invasive procedure? Well, one of the downsides to the newer procedures is that we have less information about outcome and durability. So we know that these less invasive procedures can alleviate urinary symptoms, and at least 2 years men should expect improved symptoms, but there's limited data at year 5 and there's no data at year 10. So over time we anticipate that hopefully men's symptoms continue to be improved, but they may need a retreatment. Some men would rather have a less risky procedure to help their urinary symptoms, assuming that there's less risk. So if they know that there's not going to be sexual dysfunction, no ejaculatory dysfunction, and it's going to help them, they may choose to do that because it doesn't burn the bridge to a more invasive procedure down the road. Should that be not good enough, or should it fail 2 or 3 years down the road, they can opt to either have a minimally invasive procedure again, they can opt to try medications, or to have something more invasive done at that time. So the main concern about these newer procedures is durability. I do hope, however, as the data matures in these clinical trials, that we see that this effect actually lasts for years, and that we do not need to be retreating men. So are you a candidate for a less invasive prostate procedure? Maybe they've told you that you need a TURP procedure, or you don't want a traditional operation, you're interested in one of these missed procedures like resume needle ablation or Urolift, which is the pull procedure. Well, it depends on a lot of factors to see whether you're a candidate. First of all, the prostate should be measured in size, and that should be done with an ultrasound, because prostate's larger than 80 milliliters. So a normal prostate is 20 milliliters. So if your prostate is larger than 80 milliliters, it's probably too large to treat with one of the minimally invasive procedures. So size is one of the things that can affect your candidacy. So if the prostate's, say, larger than a tangerine, that would be probably too big for one of these missed procedures. If your prostate has something called an intravesical median lobe, or part of the prostate that has kind of grown up into the bladder that's acting like a ball valve, that right now cannot be treated with Urolift, but can be treated with resume needle ablation or laser therapies. So the shape of the prostate and whether it grows into the bladder or not also can affect our choice in what is a good option for you. And basically, you should discuss your candidacy with your urologist. If you're interested in a less invasive procedure, certain measurements should be done, like I mentioned with the ultrasound and cystoscopy, where we look in with a camera to see the size and configuration of the prostate, should be done to make sure that that treatment is a good fit for your problem. Because the last thing you and your urologist want is a treatment that's not going to help you or have risks that are not warranted. So discuss your candidacy, discuss your interest in these with your urologist, and see what's a good fit for you. Again, at Houston Metro Urology, we offer all sorts of treatments for enlarged prostate, from non-surgical to surgical to these missed procedures. You can learn more at www.hmutx.com.